thanks so much for taking the time out to be here. My name is Genevieve Tawiah. I am a performing arts physio with a specialism in vocal physiotherapy. I have about 9 years history of being a physio and 8 years of which have been spent in and around the performing arts industry, whether that be in private clinics or in theatres, in town and on tour, TV work, and also supporting the music industry and artists performing. This abstract or upcoming article, The Role of Physiotherapy as part of a multidisciplinary approach to vocal rehabilitation and care, professional voice, is a mouthful, was put together by myself and Lucie Rayner. Lucie Rayner, give us a wave. So we are both really passionate about spreading awareness of what physiotherapy has to offer when looking after people with voice disorders and just outlining our scope a little bit more. So just to kind of give this some perspective in the room, can you please pop your hands up if you've ever had a difficulty with your voice, whether that be breaking, complete loss of voice, loss of range if you sing? Anyone at all? But yeah, quite a few hands up in the room. So, but what do the stats say? About a third of the population will be affected by dysphonia, which is difficulty in speaking, at some point within their lifespan. 25% of these individuals lose considerable time off work as a result of this voice disorder, and about 40% of these disorders were thought to be functional. Now, when we think about the performing arts industry and maybe actors or singers that might be doing like 8 shows a week, I might also have other vocal commitments outside of this, whether that be voiceover work or potentially singing on Zoom, we must consider that these stats may well be a lot higher. There was a study done in 2017 by someone called Manso that looked at a systematic review of all the data, and it was in particular on singers, and the stats for dysphonia rates were 46%. We also consider there's been a lot down since there. A lot of workers have moved to remote working and people might be singing teaching over Zoom. There's a lot of other functional influences that may have come to play to increase those stats. On the BAPAM website, there is brilliant guidelines that recommend that if you've had a voice disorder for more than 2 to 3 weeks, you be seen for assessment in a voice clinic. Now, unfortunately, accessing a voice clinic can't always be immediately accessible, whether that be to perform a schedule or potentially wait lists or expenses. So what can physios do to help? So I'm going to break it down into a few different sections, the first of which is manual therapy. Physios are well versed in using their hands-on skills to the following, so massage techniques, assisted stretches, joint mobilisation or manipulation requires a little bit of extra training, but often MSK physios have that additional, and also facilitation. In research, it shows that specific manual treatment can improve outcomes in voice reduction, quality, range and ease when compared to no treatment, and also used in conjunction with speech and language therapy. Now, the research that's out there predominantly looks at laryngeal manual therapy, which is techniques locally around the larynx, but we must consider that physios are trained in treating around the body. So where someone might have a shoulder issue, that might affect their posture, it can have a knock-on effect on how the neck homes the larynx. Or for the physios that are skilled in treating around the jaw, there's a lot of muscles that coincide with pain disorders that link the jaw to the larynx. So there's a few other skills that we can bring into there in conjunction with the laryngeal massage. Respiratory physiotherapy. So our voice works as a result of air vibrating on vocal folds. So if our breathing is inefficient, it has a direct ability to influence our voice. Now, a good example of this that I thought to bring, and I would normally show a video, if you've ever seen a sports person interviewed directly after they've done the event, they're often quite wispy, or the pitch of their voice will change, and it will sound quite effortful compared to their normal voice. Now, often performers aren't necessarily interviewed directly after a show, but we can consider that efficiency of breathing or the demand on our respiratory system may well influence the voice. So in the UK, physiotherapists are required to do a respiratory module as part of the study, and they learn about respiratory pathologies and the mechanics of breathing. And we also are required to do a respiratory placement, so that leaves us well versed to understand the mechanics of breathing and how pathologies might present. Clifton's article reference just at the top there gives a really nice overview of how physiotherapists are well versed to take a biopsychosocial approach to that assessment. So when it comes to voice, why is this important? because we can give education and advise people on what the normal mechanics of breathing are, so it increases their kind of self-awareness. We can teach non-voice breath strategies for baseline improvements in someone's breath control, so they've got a foundation to then go to their speech and language therapist or their voice coach and work on more specialised breathing techniques for the voice. We can also consider the impact of structures around the body that might be influencing their voice and treat that for more space for like expansive breathing. And we might be able to identify when there's a need for further assessment or further input if there looks like there's an undiagnosed or not well managed breathing disorder present. Exercise therapy. Oh, that's what voice there too. Exercise therapy. If we treat an area, we want the effects to last. So it usually involves giving our patients some form of tips on day-to-day management, or it might even be prescription of some form of exercises to offload the issue. So if I was to take a really horrible posture like this, and I spent most of my day with my shoulders forward and my neck protracted, the front of my neck and around here would probably be quite tight. And if I did any, or saw someone for physio or manual treatment for this, it would alleviate it. But if my habit still stands, I'll just come back to this position. So physiotherapists can be beneficial in terms of thinking about what muscles will allow me to keep a more upright, open posture. So they might give me some strengthening exercises for my back, or things to do throughout the day if that correlates with a certain habit that I'm doing. We can also consider that injuries might make us compensate and stand to one side, so that injury management may then have a knock-on effect on how we then go to voice. Health promotion. So there's quite a few things on here. I'm just going to give a bit of an overview. A lot of these factors are routinely discussed anyway as part of a routine subjective done by a physiotherapist when they're trying to collect information. We've got a direct role in health promotion for our patients. So things that we might want to discuss when it comes to looking after the voice include, have they had an increase in vocal load recently? Is there anything that they might realise that they need to pull back on to facilitate their vocal efficiency? Is there any new stresses? So we know that in research, anxiety and stress can have a direct effect on our neurological system. It might cause us to hold a bit more tension than usual, and it can affect our breath control as a result of that. So it's just something worth considering and knowing whether they've got stress management techniques to help them with that. Is there anything that makes it easier or worse? So we know that phenotropic behaviours such as shouting and whispering put more stress on the vocal folds, so might not be beneficial when people are trying to optimise their voice. And things that make it easier, we found that in research, meditation has helped to improve people's perceptions of their voice. Warm-ups, have they got one? Are they doing a vocal warm-up? Now, it's out of our scope to prescribe any form of vocal warm-up, but we can signpost people to their vocal coach or their speech and language therapist for this if we highlight that this is a factor that they might need to kind of whiz up on. Nutrition, it has a direct effect on our energy levels, sleep, and also potentially has an influence on reflux for those people that it affects. Now again, we can't truly diagnose people with reflux, but we can refer on if we feel that they need some support in that nutrition area. So this gathering of information can sometimes form a bit of a pathway to self-management to prompt people to uptake certain habits, but also helps for onward referral and giving information onto those specialists. It may all sound really, really simple, but we all forget things when we're busy or stressed, so it's always worth reminding our performers about these factors, and quite easily done by physios. Just moving swiftly on, there are some other modalities to consider. Now I could delve into our insight of neurological pathologies, whether that be brain or peripheral, and how that might lead physios a bit more well-versed to identify if there's a possibility of a neurological linked voice disorder, and hence refer on. But it would probably take me all day, and I could talk forever about this, so please come and speak to me afterwards if you would like a bit more information on that. But just a few things here that physios might up-train to kind of help with the vocal management. There was a study done by Rubin et al. Where a physiotherapist did ultrasound treatment to have a look at the abdominal activity in that region for singers whilst they were voicing. They found that transabs activity, when it was thinner and less active, correlated with high levels of dysphonia, and conversely, a really overactive external abdominals would be a hindrance essentially. So this might be useful for assessment in a multi-professional clinic or also in treatment planning. Acupuncture, we know it's really useful for managing other MSK-linked issues, but there's only a few studies on this in the vocal health field, and we don't know if it's statistically significant when compared to other treatment strategies, so a bit more insight is needed there. And also, taping is used in a lot of MSK environments to give people proprioceptive feedback, or offload injuries, or just encourage posture. But there's not much on it in regards to the voice, and what would be interesting to see is if it helps those postural linked functional dysphonias and whether that has a statistical difference too. So, I've given a bit of an overview on all the factors, well, not all of them, quite a lot of the factors that physios can contribute to, but we're not the lead of the MDT and we don't work alone. A little bit of a pathway just to kind of discuss how a patient might go about finding their way to us. So let's say I'm an actor and I've got a really husky voice and I'm struggling performing. I might then go and see my GP for a bit of advice, or I might consult PAMA if I'm looking for funding or quicker tips. The GP at that point should rule out anything infection linked or obvious that might need initial medication prescriptions, but then refer on to an ENT. Now this might happen via BAPAM, but the assessments are often done by a doctoral physio to gather that information before referral onwards or before assessment for funding. So you get to the ENT, they should do a laryngoscopy and have a look at that under a stroboscopy to determine what the diagnosis there is. Once you've got the diagnosis, the ENT might then choose to do a procedure if it's surgical requirement, or quite commonly, the referral is then sent to a speech and language therapist or back to the vocal coach. And at this point, sometimes physio get involved if there's deemed to be some form of functional, postural, tension influence. Now, physios can also come into play as part of maintenance if someone knows they've got a history of this functional deficit, or they know that they've had a change of activity that is contributing to it. There's also a big list of other professionals such as nutritionists, gastroenterology, lots there that might also be involved if that's thought to be a cause, and consideration of employers, company managers, if there needs to be discussions around vocal loading. So, we're coming towards the end of this, and hopefully you've soaked a bit of useful information. I haven't talked too quickly for you. The takeaway is really important. Vocal physiotherapy is an umbrella term for laryngeal manual therapy, for exercise therapy, for some of the respiratory considerations. And we've got a lot of skills that we have to offer to potentially change vocal outcomes, but also assist as part of the team. And this article hopefully will be coming out in full in the near future, so please look out for it. And just a consideration of the next steps that we're hoping for post people thinking and talking about this. We want awareness of vocal physio to be much better, for health professionals to know about it, but also for patients so they know that it's an option for their care. We need a clear pathway to train into it because it is specialist. It's not routinely trained on as part of the physiotherapy course. And we need to make sure that our patients are safe when they're getting hands-on treatment around the neck. We need more opportunity for MDT working due to aforementioned reasons. There's loads of benefit from collaborative working, and more research is required to back up our methods and what we potentially have to influence. That's me. References are up on the slide if you want to take a picture, or if you do want these articles, it's probably easier to grab my contact details after and email me, and I can send you a document with them in because it's a bit tiny on the screen. And those are my contact details. So thank you so much, and any questions, shoot my way or find me.
So we can take a few questions. We have 3 minutes here, and for those people who came in late, we are lucky.